This is one of those things no one really sits you down and explains properly, and they should. It shouldn't be rushed, awkward, and definitely not filled with myths, because there's a lot of misinformation around vaginal health, a lot of products being sold that you don't actually need, and a lot of women quietly dealing with discomfort, infections, or confusion, thinking it's normal. So in this video, I'm going to walk you through how your body actually works, what keeps your vagina healthy, what silently disrupts it, and simple habits, daily, after sex, and even through your diet, that genuinely make a difference. No shame, no overcomplication, just clear, factual care. Part 1, how the vagina actually works. Before we talk about care, you need to understand this. Your vagina is not supposed to be sterile. It's supposed to have bacteria, specifically good bacteria called lactobacilli. These bacteria produce lactic acid. Keep your vaginal pH acidic, around 3.8 to 4.5. Prevent harmful bacteria and yeast from overgrowing. This is what protects you from things like bacterial vaginosis, BV, yeast infections, candida, irritation, and imbalance. So when something disrupts that environment, your pH changes and harmful bacteria can take over. That's the foundation of almost every vaginal issue. Part 2, washing. What actually helps versus harms. Let's clear this up properly. When you shower, you only need to wash the vulva, the outside area. Use warm water or a very mild, fragrance-free cleanser if needed. Avoid scented soaps, shower gels, feminine washes with fragrance, antibacterial soaps, because these can kill the good bacteria, raise your pH, cause dryness and irritation. And this is important. Never wash inside your vagina. No douching. No rinsing internally. Even water inside can disrupt your natural balance. The vagina cleans itself through natural discharge. That's literally your body removing unwanted bacteria and maintaining balance. So if you feel like you need to clean inside, it usually means something is already off, not that you need to clean more. Part 3, drying and moisture control. After your shower, gently pat the area dry. Use a clean towel. Avoid rubbing or friction, and don't dry inside. That can irritate the delicate tissue and disrupt the environment. Moisture matters more than people realize. Too much moisture, especially in warm areas, creates an ideal environment for yeast to grow. So, don't stay in wet underwear or swimwear. Change after sweating or the gym. Let the area breathe when possible. Part 4, after sex care. This is one of the most important sections, and one that's often overlooked. Urinate after sex. This helps flush bacteria away from the urethra and significantly reduces the risk of urinary tract infections. Now, to be clear, it doesn't directly prevent BV or yeast infections, but it helps reduce bacterial movement and imbalance in the area. After sex, also, gently rinse the outside with water if needed. Avoid wipes or scented products. Avoid immediate harsh washing. Also important, semen has a higher pH, more alkaline, which can temporarily disrupt your vaginal acidity. That's why some women notice changes in smell, increased discharge, or irritation after sex. This is normal to a degree, but if symptoms persist, it may indicate imbalance. Part 5, things that disrupt your vaginal health. These are the most common causes of imbalance. Scented products, soaps, sprays, wipes, douching, tight, non-breathable underwear, staying in damp clothes, antibiotics. They kill good bacteria too. High sugar diets feeds yeast overgrowth. Hormonal changes, cycle, contraception, even things like stress can affect your immune system, which indirectly affects your vaginal health. So it's not just about hygiene, it's about your whole internal environment. Part 6, healing from the inside, probiotics and diet. This is where a lot of people overlook things. Your vaginal health is closely linked to your gut microbiome. So supporting good bacteria internally can help maintain balance. Foods that contain natural probiotics, yogurt with live cultures, kefir, sauerkraut, kimchi, kombucha. These introduce beneficial bacteria into your system, also important. Prebiotic foods, which feed good bacteria, garlic, onions, bananas, oats, and reducing excess sugar is key because yeast, candida, feeds on sugar. Hydration matters too, helps regulate discharge, supports overall cellular health, traditional/natural support. There are also traditional approaches that have been used for years, some with emerging scientific support. Probiotic supplements, especially those containing lactobacillus strains. Boric acid suppositories, used medically for recurrent BV, but only under guidance. Coconut oil, external use only. Gentle and naturally antimicrobial, but it's important. Natural doesn't mean use anything freely. Always be cautious with internal use. The vaginal environment is delicate and easily disrupted. Part 7, what's normal versus not normal. A mild natural scent, clear, white, or slightly creamy discharge. Changes throughout your cycle. Not normal. Strong, fishy smell, often BV. Thick, white, cottage cheese, discharge, often yeast infection. Itching, burning, soreness. If you notice these consistently, don't ignore it. Get proper advice or testing. Vaginal health isn't complicated, but it is specific. Most issues come from doing too much, not too little. So keep it simple. Clean gently, protect your natural bacteria, support your body from within, and pay attention when something feels off. That's what actually keeps things healthy long term.